general purview of healthcare, the usual suspects are kind of the same things we talk about over and over in any sort of, conference, but labor shortage, shifting sites of care, advancement of AI, value-based care, cybersecurity, thin margins, platform plays, reimbursements. It's all that kind of everybody is talking about, as it should be, because these are big, meaty topics that have a lot of nuance. But from your purview, what are some things that maybe aren't getting talked about, or a little bit of a nuance that we can inject a different sort of perspective into some of those categories?
Well, I realize that as a consultant, I always run the risk of being Chicken Little, saying the sky is falling and things have to change, right? And I think this is one of those areas I recognize there's two sides to this, right? But I truly believe that those factors, whether it's the shift towards value-based care, the cybersecurity incidents we're facing, whether it's reimbursement degradation, and not even just reimbursement coming down within a payer, but it's the demographic shifts we're facing. There's so many different factors. The fundamental economics of healthcare, and this is where the Chicken Little moment may be, and I acknowledge that at worst, it is broken, right? Half of our health systems are not making operating profit. That is not a sustainable position for our care delivery ecosystem to be in. At best, it's breaking, right? We are seeing real cracks here. I don't know, and again, I've been in healthcare now for 2.5 decades of, it feels like it's always, it's not good, we've got to fix stuff. But we have actually made some pretty good progress in some areas. Like value-based care was not a thing when I started. We've made some progress. We've got started on that path. I think we have to fundamentally change, and the old solutions are not going to work. They're necessary. Like, we have to be focused on operational efficiency. We have to be focused on quality, but they're not enough. We have to do more, right? And I think this is just one example. There are a lot of other things that I think we have to be really creative about how to change the care model, and changing the care model in a way that recognizes we have a disintermediate economic model. The person who benefits from these approaches are not the ones who are necessarily paying for it. The ones who are paying for it are not, say, incentivized to the things the end customer wants. Like, healthcare economics are really complicated and broken in a lot of ways we're not going to solve. But I don't think trying to plow our way through this on traditional staffing approaches is the way to do it. I don't think trying to look at, it's cost cut. We need to be more efficient. That starts the analogy of eventually you hit bone, right? You do start to create some real damage that compromises your ability to do what these health systems are in their communities to do, which is serve the population, right? Improve health outcomes, deliver value to the communities. They are not for profits, despite all the media spin that we're hearing now of health systems out for maximizing profit. They are community endowments. They have community board members. There's no shareholder profiting off of their motivations. So I think it is a time we have to think differently. The old models just, again, it's either will break or are breaking.
So then let's flip the coin. I think fair point as far as, the call out on Chicken Little. And I think it's actually, I share a lot of those same views. But if you were to kind of flip that coin and say, why are you hopeful about the future of healthcare? What would you say?
I think don't waste a good crisis. I think people feel the pain, right? I think prior to the pandemic, things were, I think looking back prior to the pandemic, people were like, man, things were great back then, and the pandemic shook everything up. But I think it just accelerated a lot of change. I think virtual care, we track the consumer adoption of virtual care. For 2 months during the pandemic, there was more virtual care delivered in this country than physical care in the ambulatory setting. So that's huge, right? Now, of course, it fell back, it changed, but the overall number, it went up to 51% and then it dropped back down. But it dropped down not to the sub 1% it was before. It's like 9%. It's kind of where it leveled. Now it started to trend back up. I mean, we are seeing real signs that people are embracing innovation, embracing care delivery, thinking about different ways to approach what they're going to do to address these needs. And I think things like Medicare Advantage, it's not perfect. It's not a panacea in and of itself, but it is driving positive change. And again, I can hear the cynics who are many who's listening going, yeah, it drove everybody to get more creative about how they code for revenue, and MA has driven up costs and it's driven up, revenue to these companies. I get it. That's a fair counterpoint, but it's also now, unless you think they're committing fraud, they are more accurately coding the sickness of the patients they're serving. And now they have to innovate the care model to serve them, right? It is the necessary first step to say, this is how sick this patient is. We should be paid that amount. Now, how do we build a care model to serve them more effectively?
Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com, and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.